Thank you. And good morning. Welcome to the Foreign Correspondent Club of Thailand. If you could get your coffee, there's some food in the back, get your plates of food and come on in. We're going to start this press conference. Okay. My name is Phil Robertson. I am a board member at the Foreign Correspondent Club of Thailand. It's a pleasure to welcome you all here. We're here to talk today with UNICEF about the impact of air pollution on children's health in the East Asia and Pacific region. Actually today, UNICEF is releasing this advocacy brief, Growing Up in the Haze. It is available from the UNICEF staff here. Kiara is here and there she is in the back. She can provide you a link or send it to you electronically as well. This is a compilation of existing information that has been pulled together by the UNICEF team to look at this very serious problem that you can see outside every day now in Bangkok. And it's not just Bangkok, but it's across the region. Today we're joined by a group of experts from UNICEF. They're going to share this new regional analysis, as well as share some stories about the actual impact on children and their families, and talk about solutions on how to try to protect children from this very serious problem. The air pollution levels are, of course, rising across the region. We've seen Thailand experiencing hazardous air quality that threaten children's health and well-being. In fact, every one of the over 500 million children in the region are exposed to harmful air pollution every day. And air pollution has been linked to 1 in 4 child deaths of children under 5 in the region, 1 in 4. So it's a very significant problem. It's something that has, I think, snuck up on the governments and the NGOs and civil society in the region. And it's time to ring the alarm about how very serious this is and what needs to be done. And it impacts children from birth through adulthood, increasing risks of preterm birth, asthma, development delays, and chronic diseases. Joining us today, I'm just going to give a set of introductions of the panelists who are with us. First, we have Myo Zin-Nyunt. He's the UNICEF Deputy Director for East Asia and the Pacific on the far right, my far right. He's worked 28 years with UNICEF, working in the East Asia and Pacific and South Asia, Eastern and South Africa regions in development programs and humanitarian support projects. He spent his last 3 years in his current position here in Thailand. We're also joined by Eliane Luthi. She's the UNICEF's Regional Chief of Advocacy and Communication, wearing the lovely UNICEF blue today. She has been working for UNICEF for 12 years, leading the organization's advocacy and communications for children in East Asia and the Pacific, South Asia, and East and West Africa. Next to her is Basil Rodriques. He's the UNICEF Regional Health Advisor for East Asia and the Pacific. He's a public health specialist in maternal health and epidemiology, and he's worked for UNICEF for more than 4 decades. This is actually the 3rd time he's been posted in Bangkok, and he's spent an overall about 16 years in Bangkok, which was very lucky for him, except for the recent haze. So, and joining us online from Indonesia, where he's on mission, is Nicholas Rees. He's the UNICEF Climate Change Specialist for East Asia and the Pacific. He's an environmental specialist working for the regional office here, and he previously was the climate specialist at UNICEF headquarters in New York. So I'm going to ask some questions here, sort of kick off the proceedings. We will have an opportunity for questions from the floor a little bit later. I should also mention that we are streaming this press conference on Zoom, so people who are tuning in from wherever they're sitting can ask questions in the Zoom chat. There will be someone monitoring that chat and will share those questions with me. So let me just kick off first with Nicholas, who's online with us. Your advocacy brief and press release highlights a shocking statistic. Quote, over 100 daily deaths of children under 5 are linked to air pollution in the East Asia and the Pacific. That's a very concerning figure, isn't it? What can you add to that?
Thanks, Phil. Can you hear me okay?
Yeah, go ahead.
Thank you. Yes, no, it's incredibly concerning. About a million, well, there are millions of children across the region that are exposed to toxic levels of air pollution. And it's not just outdoor air pollution, it's in their homes, it's in schools, it's in the playgrounds that they play in. And air pollution doesn't often get the headlines that a natural disaster does. However, it's linked with about 100 child deaths every single day across the region, and that's about 38,000 over the course of the year. And predominantly, these are actually babies that don't survive to see their first birthday, toddlers struggling to breathe, and whole families stricken with the unimaginable grief as a result of losing loved ones. And as you said, about 1 in 4 childhood deaths in this region are linked to air pollution. And 1 in 4. This makes it the second leading risk factor for under 5 mortality in the region. And that's just after malnutrition. And so these are not just statistics. These are children's lives and their futures effectively stolen from them due to the air that they breathe.
Thank you. That's very, very concerning. To get a little more information, let me turn to Basil. We know that air pollution is harming children, but how exactly does it impact their health? I mean, both immediately and in the long term. You know, what are the most severe consequences that you're seeing from this air pollution?
Sure, thanks. I'll say that it does affect children at every stage of life. It starts during pregnancy when mothers are, with children in utero, mothers who breathe toxic air, we know does have an impact on their own lungs, but also has an impact on the child's health. It has an impact on, for the mother, issues around pneumonia, issues around other linked to miscarriage, low birth weight, and so on. So you have a number of issues that happens in utero. Once a child is born, you do have issues where children do breathe more rapidly than adults. And so they inhale more toxic air relative to their size. As a consequence of this, it also impacts later as they get older, their own learning linked to issues around pneumonia and other lung infections. As then they move into the later years, we know that for lung development, for girls into the late teens, lungs continue to develop, and for boys in their early 20s. So we're talking about long-term issues that impacts their own lung development, diminished lung capacity, and is linked to diseases later in life. So in summary, what we're saying is that these issues start from birth, in utero, all the way through development. So breathing toxic air, it starts today, but continues all the way through life and doesn't have an impact on learning opportunities as they get older, and especially around employment.
I know one of the things when people are talking about these issues and just in conversation in Thailand and others are what are the causes of all this pollution in the air? I mean, I remember I was here, I've been here 30 years now in Thailand. I know that it wasn't like this when I first arrived. You know, this has certainly gotten much worse over the past 5 to 10 years. And so let me ask Nicholas, what are the main sources of this air pollution in the region that you're seeing? You know, and are there particular countries or cities that are facing some of the worst conditions?
Yeah, so let me also just start by saying that air pollution is affecting children in places that are meant to be safe for them. You know, it's affecting children in their homes, as I said, it's affecting children in their schools, and these are the indoor sources of air pollution. household air pollution, which is still a really big issue in the region. In fact, more than half of the deaths associated with air pollution are linked to household level air pollution. And then there's the outdoor air pollution, which, as you mentioned, we know is incredibly bad in some parts of the region. In fact, there isn't a country across the East Asian Pacific region that the ones that UNICEF classifies in the East Asian Pacific region, there's not a single country that actually meets the World Health Organization's guidelines for safe levels of PM 2.5. So every country is affected, and that represents over 500 million children across the region. And as I mentioned, there are some countries where it's particularly high. We know it's high in China, in Thailand, in Myanmar, and in Mongolia. But about over 300 million, about 325 million children of the 500 million are living in countries where it exceeds the limits by fivefold. So that is, it's 5 times higher than what is considered safe according to WHO guidelines, and that's just a remarkably high number for children to be exposed to. I mentioned that we've kind of classified it into this household air pollution and outdoor air pollution, and that over half of the deaths are associated with household air pollution. But what we're also seeing over the last couple of decades, over the last two to 3 decades, is a shift in the proportion of deaths associated with household versus outdoor pollution. And a growing proportion of children are dying of diseases linked to air pollution due to outdoor air pollution. So there's been a lot of progress in countries on reducing household air pollution, in particular places like in Thailand and Malaysia and in China. But there are still some countries where household air pollution is accounting for the vast majority. I'm talking over 80–90% of the deaths. And those are, Solomon Islands, Papua New Guinea, Cambodia, Timor-Leste, Myanmar. These are areas where indoor air pollution is really high and really a major source, linked with diseases that are killing many children. And basically, but I will say overall, it's both outdoor and indoor levels of air pollution, and in many cases, children don't get reprieve from either. They're in high levels of outdoor air pollution, and then as soon as they go inside, they're in high levels of indoor air pollution. And without that reprieve, kids don't get a break.
Very, very worrisome. One of the countries that you just mentioned was Mongolia. And Eliane, I gather you were in Mongolia in December, when actually air pollution in that country were at particularly dangerous levels. Can you share with us a little bit about what you saw and how air pollution is impacting the lives of children there?
Sure. I was in Mongolia in December in Ulaanbaatar, the capital. It was extremely cold, and a lot of homes, not just homes, but also hospitals, health centers, and schools are still using coal to heat. So there was a thick blanket of smog covering the city. PM 2.5 levels were hazardous. And I met a little girl there called Nara. She is the daughter of a single mother with disability who is working 2 jobs to make ends meet. And the family lives in a traditional home in a ger, and they use a coal-burning stove to keep warm during the winter. So Nara is breathing in dangerous pollutants while she's sleeping, while she's doing her homework, and while she's having her breakfast and her dinner. And when she leaves her home, because the entire neighborhood is also using coal for heating, she is breathing dangerous pollutants on her way to school. Every winter she gets sick with respiratory infections, and sometimes her mother cannot afford to bring her to the doctor because it means losing wages. So I think there were 2 things that really struck me in my time there. One is that day in and day out, children like Nara are being exposed to these dangerous toxins in the very places where they're meant to be safe, in the places they live, in the places they learn, and in the places they play. And the second thing is really that it's the most vulnerable children who are paying the price for this air pollution crisis. It's the children whose families are living in poverty, who can't afford clean cook stoves, who can't afford masks, who can't afford air purifiers. They're the ones that are paying the price for the air pollution crisis. And these children are paying the price with their health, with their education, and with their very futures. And we need to do better.
That's really horrible, actually. I mean, they never get away from it. They literally never get away from it. So let me ask now, Myo Zin-Nyunt, as we've seen in recent weeks in Thailand, particularly in Bangkok, air pollution is significantly affecting education. I think there was some school closures and other things as well. In what ways is it disrupting children's education and potentially impacting the economy, in your view?
Thanks, Phil. We all are seeing and experiencing the impact of air pollution right in front of our own eyes in real time. I think this is a very, very serious challenge that a few days ago or...
Speak closer to the mic so you can, yeah.
Okay,
Yeah,
all right.
Thank you.
Hear me better? All right. Some days ago, the Bangkok Metropolitan Authorities issued instructions for people to work from home, schools to close down because of this unacceptable level of air pollution in country. And many dozens of schools closed down. Children missed the classes. Because the air is too toxic for children to breathe. So we talk about it, school closure. Okay, the children, the students may miss a few lessons because of the school closure, and it's necessary. But if you look at the experiences from COVID time, school closures not only impact on children from missing a few lessons, but also the students disrupted from their routines. Children isolated from their friends, isolated at home, and also it has some impact on their mental health, psychosocial well-being. So I think we need to be very, very concerned about school closure due to air pollution. And also even when schools open, because of the air pollution, children got sick quite frequently. They missed schools. And also this air pollution will have impact on their learning capacity, some impact on brain development. These will have a serious impact on their developmental process and also the future opportunities when they become adulthood. I think this is really important. Also, if you look from the parents' aspect, the parents, they have to look after when the children are sick, so they have to miss their work, they have to miss their, some of their earnings and wages. I think this will have impact on family earning as well because of this, the air pollution impact on health, education, and others. But if you look at the individual child, to a family, to the community, to the states, at the national level, the impact is staggering. The economic impact, the World Bank did a study, and the economic impact due to air pollution-related premature deaths and illnesses in this region are $2.5 trillion per year, which is really staggering the amount of economic loss due to death and illnesses. And as Eliane mentioned, she was in Mongolia a few months ago. Mongolia is a vast country with a smaller population. And private sector in Mongolia, they did a study on absenteeism due to air pollution. And they found out $7.5 million loss over the 5 years from the private sector staff members' absenteeism due to economic loss. So the reality is clear. The evidence is very strong that air pollution have impact on children, not only on their health, but their education, their learning capacity, their development capacity, the future opportunities, and ultimately impacting on the economy of the nation.
Right. So, obviously that calls for a number of structural changes. But let me also ask Eliane, what about crucial immediate solutions to deal with the situation? You were just recently in Mongolia, which we've talked about a fair amount because of the dire situation there. What sort of short-term interventions did you see while you were there? And were they making a difference in protecting children?
Yeah, I mean, I think it's clear that's what's needed is really large-scale change that addresses the root causes of the air pollution crisis. But in the short term, there are small-scale solutions that can really improve the quality of children's lives and the air that they breathe. So in Mongolia, we're working with the government and private sector partners to introduce cleaner heating systems in these households of the most vulnerable, poor families, helping them transition from those traditional cook stoves to cleaner energy solutions at the household level, and that really makes a big difference in terms of the household level pollution. But we're also supporting air quality monitoring in places like schools, so that we have very solid data that monitors exactly what the air quality is in these places that children attend every single day, and supporting those schools and taking measures when there are peaks in air pollution. So again, small-scale changes that can improve the quality of children's lives over the short term, but what's really needed is structural change.
So in terms of structural changes, let me ask Myo Zin for some comments on that. What sort of concrete actions do you think businesses and governments and parents and caregivers and the health sector overall need to take, starting now, to sort of curb pollution and reduce children's exposure to these toxic air?
Thanks, Phil. This is an urgent issue, but this is also an invisible issue. So I think that's where we all need to work together to make sure that this issue is brought to everyone's attention. And as we all heard from Nick, Basil, and Eliane, that every child in this region are breathing toxic air, either inside or outside of the house, in the playground, in the school, on the street. So I think this is a serious issue, but it's still an invisible issue. Everyone has a role to play, and I particularly would like to plea the media for your bigger role, in addition to the governments, the private sector, the health sector, and parents and the teachers. Media could also play a very big role in this, making this invisible killer visible. When we talk about the governments, we see, the primary role of the government is policy making, budgeting, and also implementation standards and guidelines. So government can really support to ensure that national policies on climate and environment are there to really support transition to clean energy, and also their support, national support at the household level, energy, fuel energy, that there should be also part of the national policy to ensure there is also clean fuel at the household level to prevent the household air pollution. And also, follow the standards and guidelines, international standard, World Health Organization standards, to ensure that there is a strong monitoring, awareness raising, and also implementation from the government level. The private sector also, they need, to work on more on clean energies, really cut the harmful emissions, and work closely with the other sectors to ensure that they contribute to a safer environment and safer future for the children. Health sector, particularly important. Health sector and its all development partners, the NGOs, the CSOs, civil societies. Not only health sector is diagnosing and treating, but they also have to play a bigger role in the prevention part as well, awareness raising, and educating other sectors, bringing other sectors, education sector, environmental sector, to work together to a common goal. I would like to also emphasize the role of the parents and also teachers and educators, because they are the primary caregivers, and they need to be aware. They need to really protect children and also prevent them from hazardous effects of the air pollution. And also talk to the young people to really advocate for, to call for their rights, to ensure that make governments, the private sector, and other sectors accountable to prevent and protect them from air pollution.
Right. Thank you. Yeah, I mean, it seems to me that this is a kind of hidden issue. And, prior to you all coming forward with this, I hadn't really thought about it from the perspective of children. But, there is a great vulnerability there. So let me just ask, Is there possibilities for children to like organize and come together and demand governments to do more? I mean, do you think that are you seeing children's participation on this issue yet?
Yes, definitely. You know, we are working closely with the young people. So we have what we call a young people action team. You know, in the country offices, working closely with the advocacy communication team and climate specialists to ensure that, you know, at their country level, they are really a voice to be heard. So Mongolia, one example is the youth parliament. Really, they are demanding for actions from the government. And also there are many examples in the region where young people participate. The second thing that the young people also join the COP, the meetings, you know, the global conference on the climate, you know, annual discussions. So to make sure that the voices of young people from this region are heard and also bring this to the government to take action. Eliane, do you have anything to add from your side?
Yeah, no, and I think another crucial dimension, we talked about education a lot as well, and it's really also about equipping children and young people with the evidence and with the skills and the knowledge they need to be able to take action to protect themselves and their peers and their families, but also to demand change and to really be those agents of change that we know they can be. But to do that, they need the knowledge, they need the skills, they need the evidence.
Right. We have a microphone at the back, so if people have questions that they'd like to ask to the panel, you can do so. If you're, since this is a press conference, we're going to give priority to working media. If you'd like to ask a question, please identify yourself, any affiliation if you have that. Also indicate who you're going to be directing the question to. And also, I should mention that this is being broadcast online via Zoom. Therefore, if people are online and want to ask questions, they can put a question in the Zoom chat. There is someone who is monitoring that Zoom chat, and they will relay the question. So please go ahead.
Yeah, Joydeep Gupta from the Earth Journalism Network. I have two questions. The first is a follow-up of Phil's question to Nick on sources. So is there any actual study you can direct us to on source apportionment by airshed by month? Have you actually done any quantifiable studies that you have used in your latest one? That's my first question. And second question, which is actually, again, I see in your press release that you have talked about children living near highways and near factories to be more affected. Are there any studies where you can put numbers on this, where you can quantify this that we can use? Thanks.
Okay. So questions on studies, please. Who would like to answer?
Perhaps Nick.
Nick.
I think on specific, well, what I will start by saying is that a lot of the data and the analysis conducted in this analysis comes from the IHME. So I would definitely suggest looking at that source of data, because what that data does really effectively is it compiles hundreds, even thousands of individual data sources into subnational, national representations of levels of exposure. And it does it not just for air pollution, but for a range of other risk factors as well. And so when you're getting to those questions about, different causes and different linked effects, it really does help you to be able to see what are the risk factors that are causing higher levels of pneumonia or bronchitis and so forth. That are linked with childhood deaths. And so, but it aggregates all of that. But it aggregates hundreds of these studies. So, but I would say that would be my primary source, and that was the main source of information for our analysis here. For specific country level or local studies, we'll have to come back to you to see what we have on those ones. But I would definitely start with the IHME. And then they might also have their linked studies, and they might be able to tell you which studies were involved in the extrapolation and interpretation of that micro level data to subnational and national level and global level data.
Right. Nick, what's that acronym you're using? IMHE?
Sorry, Institute for Health Metrics and Evaluation, IHME.
Institute for Health Metrics and Evaluation. Okay. So, and that information can be found online?
Yes, yes.
Okay, great.
If you Google IHME or Institute for Health Metrics and Evaluation, you'll get it, and it's a really excellent data set that really helps to analyze this and really be able to unpack the data as well.
Great, thank you. Okay, we have another question. Please go ahead.
I'm Sarah from AFP. I have also two questions, which can be directed to anyone who's willing to take them.
Yeah, speak into the microphone so we can hear
I'm
you.
a little bit too short to reach it.
Somebody can adjust that for you. There you go.
Is that okay? Okay. So the first question is on acceptable levels of PM2.5. You note in the brief that several countries in the region set the level of acceptable PM2.5 much, much higher than the WHO levels. And I'm wondering, and in addition to that, in recent weeks, we've seen governments in the region suggest that levels of pollution are acceptable when independent monitoring shows that they are far higher than what the WHO suggests is acceptable. So how problematic is it that some of these countries have not adopted those WHO standards, and what does it suggest about sort of willingness and ability then to tackle air pollution? And then the second question is related to what Eliane mentioned on the need to tackle the root causes. Could you give some examples of what should be being done, particularly to tackle outdoor air pollution, the root causes specifically? Thank you.
So first, one question about the WHO standards and some governments not necessarily following those.
Nick, do you want to take on the
Sure.
first question?
Sure, I could jump in. It is problematic. So the WHO standards are based on assessments and studies, detailed, many of them over time, which are looking at negative health effects for any range of PM2.5. PM2.5, also just to remind, is it is a catch-all term for the size of particulate matter. So it's particulate matter that is 2.5 microns in diameter, and it doesn't reflect necessarily the combination of what that particulate matter might be. It might be NO2, it might be sulfur dioxide, it might be a range of different pollutants, but it's just capturing the size. So it is a rough estimation of a problem that does vary depending on the specific pollutant and the chemical composition of that pollutant. That said, the studies are based on exposure levels, and they've demonstrated that anything above the thresholds that WHO proposes, which are 5 micrograms per cubic meter, proven health consequences result as a result of exposure to PM2.5 over that. As I said, it does still vary on what constitutes as PM2.5. So it is problematic when we're not considering that, because there are demonstrated health impacts at anything above that level. Now, the health impacts do vary in terms of their severity, of course. As soon as you start to go to higher and higher levels, that level of severity and the risk factors do become more and more pronounced and larger. And in countries where, as I said, there are 325 million children out of the 500 million children across the region living in countries where kids are regularly exposed to 5 times the limit. So I think some countries might have thresholds that feel more actionable for them, and that might be why it might be certain higher levels. It could also be due to their estimations of different types of pollutants that children are exposed to. But I would say the more countries can adhere to the WHO guidelines, the safer children will be, and the reduced effects on their health will certainly become more prevalent with if we can keep children's exposure to less than that. And critically, I know that reducing outdoor air pollution is a major challenge. And as we've mentioned, some of the root causes of this are agricultural burning. Some of the root causes of this are fossil fuel combustion associated with traffic and congestion and industry. And obviously, every effort that we can take to reduce those, I think, are going to be critically important. We know that countries put together their climate plans represented in the nationally determined contributions. And this is where air pollution and climate action can go hand in hand, because action on climate change, even though we're talking about greenhouse gas emissions, the causes are often the same, fossil fuel combustion. And so a clean energy transition is also a clean air transition and can result in healthier outcomes for children. So I definitely think that ambition on the NDCs, and also even the extent to which air pollution can be highlighted in a nationally determined contribution to the Paris Agreement, I think that can help enforce the focus on reducing the causes of ambient air pollution. But again, I also want to stress the importance of reducing indoor household air pollution, because, as I mentioned, more than half of the deaths are linked to indoor household air pollution, and that is extremely actionable. Clean cook stoves can be cost effective. Sometimes it just has to do with the degree to which a family is aware and understand the risks posed by indoor air pollution and unclean cooking. And so improved monitoring, improved awareness, these are solutions that are at our fingertips and can make a huge, huge difference as well.
I think there was a question for you too, Eliane.
I'm happy to add on. I mean, in terms of the root causes, and when we talk about large-scale change, what it really is strengthening those climate and environmental policies, and it is the transition to clean energy, aligning with the WHO guidelines, and recognizing the very strong role of businesses and private sectors, their adoption of clean energies, cutting harmful emissions, ensuring that their operations and products really contribute to a safer environment for children. I think, we've stated quite a few times already that there is enormous toll on children's health and learning, and I think we all agree no child should be breathing air that harms them. But I'd like to stress that this is not just about an individual child's health. This is about wide-ranging impacts on societies, economies. And if we address the air pollution crisis by tackling the root causes, ultimately this will have ripple effects across entire communities, societies, and economies, because there is a huge impact on healthcare spending, there's an impact on children's learning, and ultimately an impact on productivity. So this is not just about individual children's health. This is very much about children's future and ultimately the future of the countries in East Asia and Pacific.
Okay, we have a question online. Let me just read it here. Thank you. This is from Sarah Nui from The Telegraph. She says, I echo Rebecca's questions. Do you also break down which countries these deaths are taking place in, and which countries are the most children dying in due to pollution? Also, are any countries already using policies and strategies which have really worked to tackle this issue?
Nick, do you want to take that?
Yeah, sure. I kind of, I think it's to some of this. I'd like to also point out that air pollution and air pollution related deaths, it is horrific, the number of children that are dying with diseases linked with air pollution across the region, as we say, 100 children per day. But it has gone down in the last 2 to 3 decades. And it has gone down exactly as air pollution has been actually decreasing in many countries as well. So I want to highlight the potential for continued reduction in childhood deaths linked to air pollution, as demonstrated by the reduction in air pollution over the last 20 to 30 years in many countries across the region. So progress is possible, but it also goes, and I do think that government policies on this have made a huge impact. And I think we can look to some of the clean energy transitions that we've seen in many countries already pushing this agenda. Thailand, Cambodia, Vietnam have done tremendous efforts to reduce air pollution. China, tremendous efforts to reduce air pollution in the cities, and childhood deaths are going down as a result. And so I think that we need to continue and even accelerate that, because no amount of childhood deaths is acceptable, especially for something that we can solve. So I definitely think that that makes a big difference. I think one of the other things that makes a big difference is the ability of the health system in particular to respond and adapt to this. The health system has made huge improvements in terms of being able to manage the diseases linked with air pollution: pneumonia, bronchitis, asthma, treatment, prevention, awareness raising, having healthcare workers, even in remote areas, understand these risk factors and being able to communicate those risk factors to families and to children. As Myo mentioned, educators. These have all made a huge difference over the last 20 to 30 years. And so I definitely say that I want to highlight the horrific number of kids that are being affected now, completely unacceptable, but also show you that progress is possible as demonstrated in the last 20 to 30 years.
Okay. Question from the floor?
Hi there, my name is Rosie and I'm at the Bangkok Post. You talk about the role of the media in helping the situation. So what is the message that you want to be sending to the people who are the most affected, which are the people in these homes who are going to school every day, these parents? You speak of that lovely girl in Mongolia, right, who is breathing in that air all the time. So what are the short-term remedies? We've got masks and things you see lots of people wearing. What are the actionable steps that people can be taking today to protect their children and to protect themselves? Because that's, I think, what they're going to want to know when they hear all the scary numbers. They'll be wanting to know what they can do right now. So what's your... Thank you.
Okay.
Yeah, I mean, on the media part, I think what we would like to stress is that this is a child rights issue, right? That this affects all sectors of society and everyone in this room and beyond, but it is first and foremost a child's rights issue. And we need to center children as we think about the solutions and we find solutions to this issue. And on the health and in terms of what we can advise parents, I think Basil is well placed to answer.
Sure. A couple quick responses. A non-health component is actually awareness. And this very press conference is an example of that, increasing awareness of harm. But the second stage is to advise on what are the potential ways that individuals can protect themselves. The other, you mentioned things like masks, which is just beyond even pathogens, diseases. It's also about breathing air that you breathe in. The other are things like indoor air purifiers, right? Not everyone can afford, but there are instruments and there are ways. Adequate ventilation is another means of recognizing ways that you can actually protect air, at least particularly indoors. So there are elements. I think one of the tasks that we'd like to at least communicate is that there are methods, there are ways. We're not saying that everyone can sort of in a vacuum protect themselves, but it's ideally looking at awareness and also issues around policy, actions, guidelines. There are a number of areas I think that can contribute positively to at least decreasing what the air that toxic air that individuals breathe, but also how individuals can protect themselves as well.
Yep. Okay, we have some questions from Rebecca Ratcliffe from The Guardian online. The first one she has is actually a follow-up question to Nick, saying, are childhood deaths going down for all forms of air pollution, both indoor and outdoor? And then she had an earlier question which said, could you give a bit more detail about the statistics you've included in the release? It mentions that air pollution is linked to more than 100 deaths in children under 5 every day. How many years of data did you look to reach this figure? Have you conducted the same analysis in the past? And if so, is the risk to children increasing? Well, both of those to Nick, I think.
Yes, sure, happy. So yes, the childhood deaths are going down as a result of air pollution. This is not something that it is not increasing, it is going down across the region as a whole. Of course, there are pockets where this isn't necessarily the case. Areas where air pollution spikes go up. But it's going down, as I mentioned, a lot due to the energy transition within households, where countries were previously using solid fuel for cooking and heating homes, and they've converted to cleaner versions. That's been a major driver of the reason it has gone down. And it's also gone down due to improved prevention and treatment of pneumonia and air pollution related diseases, and the health system really being able and equipped to respond to these impacts. And so that's why these solutions are working. They're making a huge impact, and they have made a huge impact over the last few decades. Let's continue, let's accelerate them. Let's accelerate the capacity of the health system to respond. Let's accelerate the energy transition within households. As I mentioned, the proportion of deaths associated with air pollution has shifted in this region very considerably towards outdoor air pollution. It's still not quite half of deaths, but it's a growing proportion. It was around 20% about 20 years ago, and now it's over 40% of deaths are linked to outdoor air pollution. And so we also do need to double down on efforts to reduce outdoor air pollution. One of the most effective things that I have seen out there in terms of outdoor air pollution has been the improved monitoring. The more that we have, the more monitors and the more aware people are, the more they take individual actions and behaviors to prevent exposure. It's also an incredibly effective tool to push for policy changes and legislative changes when people can point to concrete evidence. Otherwise, they're just, saying that it's bad, and they aren't able to make the case to policymakers. So that monitoring piece is a huge element. I think in many countries, in China, in Vietnam, in Thailand, we've seen the growth of monitoring, and that has really enabled people to put pressure on policymakers to make the changes required to reduce air pollution. I'm sorry, I may have forgotten what was the other question.
Sorry here.
It has gone
looking
down.
at statistics, how many years of data do you look at to reach this figure, and have you conducted such analysis in the past?
So UNICEF has been working very closely with IHME, the data source, that they are the ones that are really analyzing and collecting this, and they have done it every year for many, many, many years. So I would, and we work very closely with them, and we published a global report earlier this year that looked at the state of global air across the whole world. That's what it's called, the state of global air. And this is a regional cut looking at that global level of analysis. And I think that these analyses will continue in the future, but it is basically every year for the last, I don't remember, it might have been two decades that they have been conducting this analysis with a high level of detail. I'd recommend looking straight at those to get data, year by year analysis. The data that I'm referring to on the 100 per day is based on, the latest figures come from 2021. So these are because we're looking very specifically at mortality linked with diseases associated with air pollution, it does take a little bit of time for the system to assess those diseases and mortality rates. And so that's why it's only coming out this year from 2021.
Right. Okay. Yep. Oh, we have a follow-up from Sarah Nui. You talked about pockets of death, pockets where deaths are not decreasing. Can you indicate which countries and places you're referring to?
Pockets where
Where the deaths are not decreasing. I think you, yeah.
Sorry, yes. I think we'll have to come back to you on that. What we'll have to, there are country level, there's specific countries, but I'm referring more to variations within countries. So this data is based on country level aggregation. So it's based on population weighted exposure. That is, they look at, so for example, Mongolia as a whole doesn't have a ton of air pollution. It's a very big country, and the air is largely clear and clean through most of the country. But in Ulaanbaatar, the capital city, the air is extremely toxic, especially at certain times of year. And so these figures are based on something called population-weighted exposure, which looks at the population that's exposed to air pollution. So I just want to point out that, and that's based largely on where people live. And the level of exposure. And so within countries, you're going to see certain areas like Ulaanbaatar, where air pollution is extremely high. We know also in Hanoi in Vietnam, air pollution is extremely high, and that tends to be high through large parts of the year, not just the peak seasons, which are around December, January. In Thailand, obviously, we know that it's high in Bangkok around now, this time of year. Similarly, in Chiang Mai, in northern Thailand, it can also get very, very high at this time of year. And it's based on seasonal patterns associated with agricultural burning. So they do vary within countries, but it's based on population-weighted exposure. So that is the population in the country that is exposed.
Okay. We have a question online from August Nye. He's a youth from central Myanmar. His question is, quote, air pollution levels are rising across Myanmar, but only some people know about it. What foresight should start implementing in current Myanmar? Is there any simple step for the role of youth? And that's a question to Myo Zin and to Nick.
Yeah, do you want to jump and I can add?
Do you
Or
want me to start? Then I can follow up.
Okay. Okay. So I think young people are proving to be incredibly powerful change agents. And we've known this for a long time, but I think on these issues and on environmental issues, young people see their futures ahead of them and are standing up and really making a big difference. And I think that there's no exception for many countries in this region where that's the case. The biggest challenge I think that young people have, though, is lack of access to information needed to conduct that advocacy. And so going back to my earlier point, I think one thing that can be really helpful is getting monitors out there, and so that young people have something to advocate on, with something with clear evidence that they can speak out about. And I know UNICEF is working with a lot of community groups and young people, also providing them with low-cost monitors so that they can take those low-cost monitors, communicate about it. They're often crowdsourcing information on air pollution in different parts of towns, villages, and cities. And I think that that's an incredibly effective way as well of making a difference. And really also just having young people connected with policy-making systems is going to be very important. Something we're also working very closely at doing is making sure that their voices are heard meaningfully in policy forums. Not just that the children are on panels and so forth, and not just that children are speaking, but that they are more intimately involved in having their voices heard and more able to get their voices to decision makers so that they can make decisions with children in mind and the needs of children and their rights in mind.
Thanks, Nick. If I may add, we had recently, 2-3 years ago, we have the General Convention 26 on the Convention on the Rights of the Child that really stipulates that the children's right to safe, clean, healthy, and sustainable environment. And also, climate crisis is a child right crisis. I think this is one legal basis for children and young people. And also recently we published a document, a report on the legal empowerment to advance climate and environment justice for children in East Asia and the Pacific region, particularly this region, really focusing on, climate impact on the socioeconomic, what are the key barriers, and also bringing the case studies from Australia, Philippines, Thailand. Thailand is a one case, in I assume Kanchanaburi, where the lead, poisoning as an environmental hazardous. So there are some strong evidence to really empower young people to move this agenda forward.
Great. Thank you very much. Question, please go ahead.
Yeah, follow-up question to Nick on the low-cost monitors. I'm sure you know this, but Met Department after Met Department in various countries are rubbishing these low-cost monitors on technical issues, including that of calibration. While you are pushing that, many other organizations are pushing that. So are you doing something about educating the Met Departments on the importance of crowdsourced low-cost monitors?
So I think that it depends on the purpose of the monitor. Obviously, I fully understand why the Met Department might have a particular need for a certain level of quality and accuracy in the monitoring, and that should be there, of course. And it's good that that's the case. We absolutely support high quality air pollution monitoring stations. The challenge is that they are also very expensive. Last I checked, they were in the, depending on a reference grade system is $70,000 to $100,000, obviously depending on the context and circumstances. These are obviously not affordable for a lot of locations. And so while that is the gold standard of what we want. We want those high quality monitors. However, if the monitors are used to help individuals and families and children understand the air that they're breathing and adjust their own behaviors in a way to help prevent exposure, I think that the low-cost monitors absolutely help considerably in that regard. And they're particularly effective because often they're smaller and they can be moved around, and you can see the air quality in indoors as well as when you go outdoors or in a school or in a playground, and they become very effective in that. So absolutely supporting the use of high quality monitors wherever possible and always, but we definitely feel that there's still value in a low cost monitor to help adjust individual behavior and reduce exposure at a community level.
Thank you. Do we have more questions? Yes, we do. Okay.
Hi, Stephen Wright from RFA. My question is for Nick, but anybody else may have an opinion on it as well. Do you see any threats to this long-term trend for air pollution deaths to decline?
Hold on a sec. Okay, try it again. Yeah.
Do you see any threats to the longer-term trend for air pollution deaths to decline, given we're in a situation where the international framework for reducing emissions, which has been one of the factors in that decline, is currently being weakened?
Yes.
Shortest answer.
Yes.
Please go ahead. Expand, he says, please.
Yes, absolutely. The degree to which we are adhering, obviously I do think that the energy transition is going to happen and is happening no matter what. We are going to see that change, and it's largely thanks to all of the efforts over the years to help facilitate that energy transition. But without adherence to WHO standards and an eroding of any kind of legal tools and mechanisms that can help prevent exposure of air pollution, monitoring the air pollution, understanding the links between air pollution and children's health. All of these can definitely help, can definitely threat the progress, not only continued progress, but also to some degree, I fear, even progress made in this regard. We're also seeing the combination of air pollution risk factors associated with other risk factors associated with climate change. And as soon as we know that rising global temperatures are increasing the frequency and severity of variety of form of climate-related shocks, hazards, and stresses, there's also interlinkages between that and air pollution, as we see a growing number of forest fires associated with climate change. These are also contributing to higher levels of pollution in the region. So I am concerned about progress in the future if we don't have strong policies and laws that are enforceable, that are enforced right down to a community level, and really and critically that the health systems are able to respond and adapt to those risk factors.
Great. Oh, yes? Nothing more.
Non-media question, I don't know if we want to answer next.
Okay, hold on. Okay, yeah, this is, I think this is, we're going to make this the last question. This is actually from someone who's an expat parent who has been living in Bangkok for the past 5 years. You speak about building awareness. Could both education institutes and healthcare sectors help to raise awareness? If so, what are some of the actionable items or examples you have seen that have worked? So talking about raising awareness, what works?
Let's start.
Who would like to go? Okay.
No, go ahead, start, Nick.
No, go ahead.
Yeah, so awareness comes in many forms, right? We talked also about the use of just schools, for example. One of the most ubiquitous piece of tools we have that's also somewhat critical is social media, right? Can also be used for good. There are different ways that one can communicate. So there are roles so peer-to-peer learning of information sharing. There is formal education, and there's simply pure awareness building. Formal institutions is not the only way that we can do so. And we said earlier about the role of media in communicating sort of the, information that can sort of help to adjust behaviors beyond simply building awareness. And so we can point to many forms. I mean, this is just maybe the most obvious ones that we can speak to, but they do make a big difference. And I guess we can probably identify examples that have been used, not necessarily for air pollution, but other ways in which we have been able to communicate risks, communicate threats, and also alter behaviors as well.
Does anybody want to add to that? Please.
Nick, would
you like to add anything to that? No? Okay. Anyone else?
Right. One thing is the awareness and working closely with the young people. I think that'll be one key. Young people as advocates for raising awareness in the communities. Help monitor the air quality and also push for stronger policies. The call for action coming from the young people, the youth movement will also really help.
Yeah. Okay. I think we're coming to the end. I'd like to ask whether anybody wants to have any final last words from the panel or from Nick in Indonesia. Does anybody want to raise any last points? If not, let me thank you all for coming to this press conference, the UNICEF press conference. And the panelists will remain after the event, so if you have follow-on questions or anything like that, you're certainly welcome to come up and catch them here. Thank you very much for calling in from Indonesia, Nick. We appreciate it. And good luck with your mission. And that's it from the Foreign Correspondents Club this morning. Oh, and the report. If you need the report, it is online. If you're here in the club, Kiara over here can help you with that. Thank you very much.
Thank you, Phil.